Intravitreal injections are a way to deliver medication directly inside the eye by injecting that medicine with a very small needle through the white part of the eye. This allows us to treat a variety of conditions. Intravitreal injections are a treatment option for a multitude of eye conditions. However, there are a few more common conditions that we do treat with intravitreal injections. One of the most common ones is exudative macular degeneration, or more commonly known as wet macular degeneration. Today, it is the current standard of care to treat these patients with intravitreal injections. Another common condition that we see at the UPMC Eye Center is diabetic retinopathy. Combining intravitreal injections with laser treatment has allowed us to treat these patients more efficiently with better outcomes. The last condition that's a very common condition to be treated with intravitreal injections are retinal vein occlusions. These are blockages in one of the main vessels of the retina, and these can be treated very effectively with intravitreal injections as well. The procedure is done in an outpatient setting right in our office. The first step of the procedure is applying an anesthetic to the eye to make the eye as numb as possible. Despite patients' concerns, this procedure is oftentimes a painless procedure for the vast majority of patients. We then apply betadine to the eye to make the procedure as sterile as possible. And then we use a very small needle to inject the medicine directly inside the eye through the white part of the eye. After the procedure, we then instill antibiotic eye drop into the eye, and we have the patient use the antibiotic drop at home for 4 to 5 days after the procedure. The patients usually return approximately 1 month later, and then we reassess the patients at that visit. And we use a combination of exam and testing to see how the patient is doing. And based on the exam and testing, that help us determine what to do next. Oftentimes, these patients will need multiple injections because these conditions can be very difficult to treat at times. Prior to the use of intravitreal injections, treatment of these conditions often involved just stabilizing the vision or stabilizing the eye. We weren't able to improve vision in a lot of these patients. However, now with the use of intravitreal injections, this allows us to do something we couldn't do before, and that's actually improve the vision. Not everyone gets vision improvement, but a large percentage do. At UPMC Eye Center, all of our vitreoretinal surgeons are fellowship trained and have extensive experience in intravitreal injections. In addition, UPMC Eye Center has access to all of the FDA-approved drugs for intravitreal injection. This allows us to have a personalized care plan for every single patient that comes through the door.